My name is Rochelle Knudsen, and I have my doctoral degree in physical therapy, and I'm a clinical physical therapist. Pros of my job is that I get to help people. I get to meet a lot of different people. It's a lot of variety. So in my day, I may see some shoulders, some necks, some backs, some hips, some ankles, kind of a lot of different things, a lot of different ages. So it's really nice in the diversity. The cons of it are the paperwork. Typically, I do probably 5 to 10 hours a week beyond when I see patients of paperwork, because that's just how the medical care system is. So some physical demands I have to go through every day is some patients need help with their balance, so sometimes I have to get really close and hold them, make sure they don't fall, don't hurt themselves. I end up doing a lot of hands-on activities, so I have to be careful that I'm not hurting my hands, especially my thumb joints are really susceptible to injury, so I have to be careful with those kind of things. So my favorite story isn't necessarily a happy story. When I was getting my degree, I was in a hospital setting with a woman who had something called psychogenic dystonia, which meant that she had her right hand and her thumb was kind of tucked in, and she kept it like this. And it wasn't because she was having any medical issues actually going on. It was that her brain was having some sort of challenge, and it was expressing itself as a hand like this. So despite trying as hard as we could to try and get her to open her hand, to relax it, we just weren't able to, because it was a physical symptom that was coming from the brain. Sure. So usually what happens is a patient will come in for an initial evaluation where I'll ask them some background questions. How long has this been going on? When does it hurt? Have they found anything that helps? And then depending on what their answers tell me, then I go and I'll look into things more specifically, and I'll try to see if I can identify what exactly the problem is. So sometimes it's a case of the joint doesn't move as well as it should, so then I try to move it for them. Sometimes they lack some strength, and so then teaching them the tools they need to kind of help strengthen them up. And it's not a quick fix. Usually patients are often seeing me a couple times a week for several weeks, and just progressing them kind of to their tolerance depending on what they have going on. So some things people should know about going into my profession is that it's a lot of work to get the degree, but I think it's totally worth it. I love my job, but I did get my bachelor's degree, and then I went on to get my doctoral degree, so that's 7 years of additional schooling. And I think, if you have kind of a medical side of things and you really want to help people, there's a lot you can do, but, there's also a lot to know, so you can get frustrated that you see people and you can't get them better, and maybe just physical therapy is not the right thing. There's a couple of different things. You want to make sure that you have good posture, which means that your shoulders are back and relaxed, that your head's back. You also want to make sure you have strong muscles in your glutes, because if those are weak, you're more likely to have knee problems, balance issues, and knee pain that will result in eventually needing a knee replacement when you get much older. So now I'm going to show you guys some exercises I think you should do to help with your posture. So we have our lovely model here. So the first thing I want you to do is I want you to roll the shoulders backwards. Just nice, gentle, easy, always backwards, because you roll forward, just encourages slouching. You don't get slouching. It's common to feel some snapping, some popping, some clicking. Don't worry about it if it doesn't hurt. How those feel? Good. Okay, so the next one I want you to do is you're going to pull your shoulder blades together, hold about 5 seconds, and relax. So do a couple more of those. These are called shoulder blade pinches, and they work on bringing your shoulders back into a good position. How's that feel?
Good. It like pinches, but
yeah. Okay, so the last one I want you to do is something called the chin tuck. So what you do is you keep your head nice and level, and you bring your head straight back, trying to give yourself a double chin. Good. Hold a couple seconds, and then relax. Sometimes with the chin tuck exercise, people get headaches with them. So if that starts to happen, back off a little bit, but continue to do the exercises. It's important.
How long should they do each of these exercises?
So you should do these exercises, about 10 of each exercise, 2 to 4 times a day, just so you don't ever lose your bad posture. So now I'm going to show you guys some of my favorite exercises to keep your core and your hips strong. So Kiana, if you can go ahead and lay down on your back for me. All right. With your knees bent and your feet resting. Good. So this is called a pelvic tilt. So what I want you to do, I want you to suck your belly button towards your spine. Okay. And hold it there for a couple seconds. Good. And relax. So the muscle we're trying to go for is in the front of the abdomen. If you're not sure if you're getting it, you take your hands, find the front of your hips, go in and down, and then suck your belly button. Do you feel it come into your fingers? Yes. That's that muscle we're going for. So the next one I want you to do, go ahead and roll onto your side for me, please. Okay. It's called a clamshell. So your knees are bent with your heels lined up with your buttocks and your back nice and straight. You keep your feet basically together, and I want you to open and close your knees for me. Good. And come back down. So with the pelvic tilt, you want to do about 5-second holds 10 times, and these do about 20 times on each side. And you should feel a nice burn kind of in your glute. And the last one I really like to give people is I want you to get into that side plank position. I call these stars. So you're going to be on your elbow. You lift your hips up into a side plank, and then you kick your top leg up and then back down. So the goal is to be able to do 10 of these in a row, but if you need to take a break, that's okay, and switch to the other side.